are ADIR and ADOS scores interpreted? Have you ever wondered how professionals interpret scores from the Autism Diagnostic Interview-Revised and the Autism Diagnostic Observation Schedule? Understanding these scores is essential for diagnosing autism spectrum disorder. Let's break it down in a simple way. The Autism Diagnostic Interview-Revised is a structured interview conducted with parents or caregivers. It focuses on the individual's developmental history and behaviors in 3 key areas: social interaction, communication, and repetitive or restricted behaviors. Each area has its own score, and higher scores indicate more pronounced traits associated with autism. There are specific threshold scores for each domain. If a score exceeds these thresholds, it suggests the presence of autism-related symptoms. This tool is particularly useful when the developmental history is reliable, as it captures behaviors from early childhood. However, it may miss some cases, meaning it has lower sensitivity but similar specificity compared to the Autism Diagnostic Observation Schedule. Now, let's talk about the Autism Diagnostic Observation Schedule. This is a semi-structured assessment where a trained examiner interacts with the individual through activities designed to elicit social and communication behaviors. The assessment includes different modules based on the person's age and language level. Behaviors are scored on a scale from 0, indicating no abnormality, to 3, indicating moderate to severe abnormality. The scores are summed within areas like social affect and restricted or repetitive behaviors. These total scores are then compared to established cutoffs to classify the individual as having autism, autism spectrum disorder, or being non-spectrum. This tool is sensitive to current behaviors and is often used when developmental history is not available. Interpreting the scores from both tools together provides a fuller picture. The Autism Diagnostic Interview-Revised gives insights into early symptoms, while the Autism Diagnostic Observation Schedule captures current behaviors. Sometimes, individuals may score high on the Autism Diagnostic Interview-Revised but low on the Autism Diagnostic Observation Schedule. This can indicate symptoms that are not as visible during observation. These individuals are sometimes referred to as ADOS negative. In such cases, the Autism Diagnostic Interview-Revised may better reflect the severity of symptoms. Both assessments highlight the importance of social and communication domains for diagnosis, while repetitive behaviors are less predictive on their own. Scores from both tools help estimate the severity of autism, with higher scores indicating greater symptom presence. However, raw scores are not always directly comparable across different ages or language levels, especially in the Autism Diagnostic Observation Schedule. Clinicians interpret scores from both assessments alongside their clinical judgment and other evaluations to form a complete diagnosis. Using both tools together improves diagnostic accuracy, especially in complex cases or when distinguishing autism spectrum disorder from other conditions that may have overlapping symptoms. Understanding how these scores are interpreted clarifies the diagnostic process. It emphasizes that autism diagnosis relies on observed behaviors and developmental history rather than a single test result. Each individual is unique, and the spectrum nature of autism means that symptoms can vary widely from one person to another.